Our ethics case is about Carolyn, who's a third-year DPT student in her final clinical rotation. So to set the scene, Carolyn is a third-year DPT student starting her third clinical rotation. Scott is a physical therapist at Gaining Independence Rehabilitation Hospital and is Carolyn's clinical instructor. Scott has been a clinical instructor for 2 years and has overall had pretty much positive experiences with all the students he's mentored. Upon her arrival, Scott notices that Caroline appears to be nervous. Scott has already scheduled evaluations for Caroline to perform later in that day. Caroline believes that this is too much for her first day and asks to simply observe him. Scott agrees, but assumes she will feel more comfortable to conduct evaluations after observing him. After day 1 of observation, Scott asks Caroline to perform 4 patient evaluations the following day. Caroline requests that she just start with 1 evaluation, which Scott reluctantly agrees to. At the end of week 1, Caroline is fully responsible for only 3 patients. Scott is concerned with Caroline's productivity, but also notices Caroline has difficulty communicating with patients, displays a lack of self-confidence, and doesn't perform interventions safely. The realm for Scott's dilemma is individual, since his decision directly affects Caroline's ability to graduate her program. If Scott gives Caroline a failing grade on her final clinical, then she will not be able to become a physical therapist. This is in the individual realm because his choice directly impacts her career, but also has implications in the societal realm. This is because if he passes Caroline and she goes on to be a physical therapist, she could potentially hurt someone. The individual process for this case would be moral motivation. Scott needs to act morally and not allow Caroline to pass the clinical trial or the clinical rotation because she has demonstrated that she is not prepared and is unwilling to work to improve her skills. Scott needs to put these moral values over his personal feelings about Caroline and his reluctance to fail a student who has worked for years to get to this point. Scott's situation is an example of a moral dilemma. On the one hand, Caroline has not met his expectations, and he is required as a clinical instructor to make sure students are prepared to operate autonomously and to do so safely. On the other hand, Scott does like Caroline, and she has improved slightly from her poor first couple of weeks. Scott also feels that he would have feelings of guilt if he ended Caroline's hopes of becoming a physical therapist, even though he knows she may not do well in a clinic. So the questions arise as, should he be the one to make this difficult decision? Should he pass her and hope she fails the boards? Or should he hope that she learns quickly when she is a working physical therapist? The facts here are that Caroline demonstrated a lack of motivation, personal responsibility, and the skills necessary to practice physical therapy. Major stakeholders: Caroline, whose future career is on the line, her future patients, who may not receive the best care, and Scott, whose reputation as a clinical instructor is on the line if he chooses to pass her. And the consequences are Caroline will not be able to continue as a physical therapy student. If she is passed, without meeting standards, she could be an unqualified registered physical therapist. Code of Ethics Principle 2. Physical therapists shall adhere to the core values of the profession and shall act in the best interests of patients, clients, over the interests of the physical therapist. It is in the best interest of the patients that Caroline not be allowed to become a practicing physical therapist. Even though she showed improvements, it's clear to Scott that she is not qualified. Code of Ethics, Principle 3, 3b states, physical therapists shall demonstrate professional judgment informed by professional standards, evidence including current literature and established best practice, practitioner experience, and patient-client values. Caroline does not perform to the professional standards of a physical therapist. So in this case, Scott is ethically obligated to address this. Code of Ethics Principle 4, 4a states, physical therapists shall provide truthful, accurate, and relevant information and shall not make misleading representations. So if Scott allowed Caroline to pass her clinical rotation, he would be providing a misleading representation of how she actually performed. To adhere to the Code of Ethics, Scott needs to provide a truthful representation of Caroline's shortcomings and why she isn't qualified to be a physical therapist. Code of Ethics Principle 5, 5e states, physical therapists who have knowledge that a colleague is unable to perform their professional responsibilities with reasonable skill and safety shall report this information to the appropriate authority. Although Caroline is not a colleague of Scott's, he is still required to hold her to the standard of an entry-level physical therapist. So since Scott notices Caroline lacks a number of the skills necessary for physical therapy, he is, in this case, ethically obligated to fail her, which is unfortunate, but it's the right thing to do. So professionalism in physical therapy, the core values for Caroline: accountability, seeking and responding to feedback from multiple sources. Caroline was not responsive to Scott's advice. Instead, she refused to step out of her comfort zone and adapt to things that she might have done wrong and put the effort in to change those. Assuming responsibility for learning and change. Caroline took a very passive role in her clinical rotation and did not try to improve to meet Scott's standards. Next, excellence. Demonstrating investment in the profession of physical therapy. Caroline demonstrated that she didn't want to improve her evaluation and intervention skills. And demonstrating high levels of knowledge and skill in all aspects of the profession. Caroline was not at the skill level at the beginning of the clinical rotation and made only small improvements by the end. Professional duty, demonstrating beneficence by providing optimal care. Caroline did not perform interventions safely, so much so that Scott had to actually remove multiple patients from her care. Professionalism in physical therapy, core values for Scott, the CI in this case. Accountability, acknowledging and accepting consequences of his or her actions. If he passes Caroline, she may not be a qualified physical therapist, which would put potential patients at risk. Educating students in a manner that facilitates the pursuit of learning. Scott did, in fact, make an effort to meet Caroline halfway, but also encourage her to assume more responsibility. Altruism, placing the patient-client's needs above the physical therapist's. The patients Caroline may see in the future should take precedent over Scott's desire to not end her educational career. Integrity, adhering to the highest standards of the profession. If Scott passed Caroline, he would be allowing a subpar therapist into the workforce, which is certainly an ethical dilemma. Professional duty, preserving the safety, security, and confidentiality of individuals in all professional contexts. Scott must consider the safety of patients Caroline may see in the future, as I said before. So implementation of Scott's decision. The ethical decision is for Scott to not pass Caroline through her third and final clinical rotation. Considering what happened during this time with Scott in the clinic, in the rehab facility, since it is evident that she is unqualified in multiple facets. Scott should inform Caroline's ACCE that she did not meet his requirements for completing her clinical rotation. Evaluation and reassessment. In terms of evaluation, this was the ethical decision to make because it puts Caroline's future patients' needs ahead of Caroline herself. It is possible that the board examination should be changed to require a clinical component, since Caroline was known to be a very good student, but lacked the clinical skills to operate effectively and safely. Scott will have learned that not every student will succeed under his guidance, but he knows that what he was asking of Carolyn was standard for her educational level. And in regards to reassessment, Scott's decision was correct. Carolyn does not have the clinical skills to become a physical therapist based on her shortcomings in this third and final clinical rotation. Had he chosen to pass Carolyn and hoped that she failed the boards, she could have gone on and been an unsuccessful physical therapist in the field. And these are our references. And thank you for listening.